In the mid-19th century, amidst the turmoil of the Crimean War, a figure emerged who would revolutionize the world of healthcare and nursing: Florence Nightingale. Born into a wealthy British family, Nightingale defied the expectations of her time, pursuing a calling that was far from the conventional path laid out for women of her status. With a fervent dedication to improving sanitary conditions and a profound compassion for the sick and wounded, she journeyed to the warfront. There, Nightingale transformed military hospitals by introducing rigorous hygiene practices, significantly reducing the death rate. Her work in Crimea was just the beginning of a lifelong crusade to reform healthcare, culminating in the establishment of the modern nursing profession. Nightingale's story is not just one of medical innovation but also of relentless advocacy for social change, embodying a legacy that continues to influence and inspire.
In the grand tapestry of history, where individual threads weave the narrative of our shared past, the story of Florence Nightingale shines as a beacon of compassion and innovation. Born in 1820 into a wealthy British family, Florence was expected to lead a life of social grace and domesticity. However, she was drawn to a different calling, one that defied the societal norms of her time: nursing. Florence's journey began with a profound belief in helping others, leading her to pursue nursing despite her family's objections. Her passion and dedication were soon put to the test during the Crimean War in the 1850s. The British military hospitals were places of despair, where unsanitary conditions led to rampant infection and a high mortality rate. When Florence arrived at the Scutari Hospital in Constantinople, she was appalled by what she saw: soldiers languishing in filth, suffering from infections and neglect. With unwavering resolve, Florence set to work. She introduced rigorous cleanliness standards, organized the supplies, and improved ventilation and diet, transforming the chaotic hospitals into havens of care. Under her watch, the mortality rate plummeted, earning her the nickname, "the Lady with the Lamp," for her nightly rounds to comfort the wounded and sick. But Florence's vision extended far beyond the battlefields and hospitals of Crimea. She recognized that the lessons learned there could revolutionize healthcare. Returning to Britain, she became a relentless advocate for healthcare reform, using her experience and statistical skills to lobby for better sanitation in hospitals and public health in general. Florence's contributions led to the establishment of the Nightingale Training School for Nurses, changing the face of nursing from a mostly untrained job to a skilled, respected profession. Her written works, including Notes on Nursing, laid the foundation for modern nursing practice, emphasizing the importance of hygiene, patient care, and continual learning. Despite facing health challenges in her later years, Florence Nightingale's spirit never waned. She continued to write, consult, and advocate for healthcare reform until her death in 1910. Her legacy endures, not just in the Nightingale Pledge taken by new nurses or the Florence Nightingale Medal awarded for excellence in nursing, but in the very essence of nursing and public health today. Florence Nightingale's story is a testament to the power of one individual's vision and perseverance to effectuate profound change, embodying a legacy of care, compassion, and relentless pursuit of betterment in healthcare for generations to come.
1. Defying social norms. It was highly unusual for a woman of her social standing in Victorian England to reject a life of comfort and privilege to work in the challenging and often grim field of nursing, especially in war zones. 2. Statistical savvy. Nightingale was a pioneering statistician, using data visualization techniques like the Coxcomb chart, which was unconventional at the time, to present data on mortality rates effectively. Her ability to leverage statistics to advocate for healthcare reform was not just pioneering but also quite strange for a woman of her era. 3. environmental approach to healthcare. Her insistence on the importance of sanitary conditions in patient care was groundbreaking. At the time, the links between cleanliness, infection, and patient outcomes were not well understood, making her focus on hygiene a strange yet revolutionary approach to healthcare. 4. The Lady with the Lamp. Her nightly rounds, providing care and comfort to the wounded soldiers by lamplight, gave her an almost mythical status and highlighted her deep personal commitment to her patients, a level of dedication that was extraordinary at the time. 5. Long-term impact. The sheer breadth of her influence on nursing and public health, transforming nursing into a respected profession with rigorous training, and her impact on hospital design and public health policy, is extraordinary. Her legacy is peculiarly vast for an individual, particularly a woman in the 19th century.